Well, as the second wave of COVID-19 sweeps through the country, those working on the ground say rapid mobilization is needed. This is to prevent unnecessary deaths and ease the pressure on health workers. Doctors Without Borders has been supporting public hospitals. The organization's Claire Waterhouse joins me now live. Claire, thanks for your time. We appreciate it. So, in a weekend newspaper, you said rapid mobilization is needed to prevent unnecessary deaths. That's a worrying statement, right? And points to people dying when they really shouldn't be. Unpack that for us.
Thanks so much for having me, first of all. Yeah, we are very concerned about the situation as we barrel into the second wave. We're already seeing in some parts of the country that we've reached numbers of patients that were seen at the peak of the first wave, which makes us very concerned about what is to come. And what we've identified through our work on the ground, we've been involved since the beginning of the pandemic. We've seen that what is critical is to have the right HR on the ground. That means doctors and nurses and other health professionals on the ground in the hotspots as we need it. These peaks can often be over in a couple of weeks, several weeks. So it's very important that the time is taken to plan now and react very rapidly as the hotspots happen, because taking the time to plan when the hotspot occurs will not be quick enough action. And unfortunately, what we see is that a lot of facilities now have enough beds, they have enough oxygen, they have the infrastructure they need, but they have a much less human resources on the ground than what they had in the first wave due to issues like exhaustion, burnout, sickness of staff. And ultimately what that means is that even if beds are there, they are not the nurses and doctors to look after the patients in those beds, and we're concerned that that may lead to unnecessary death.
Yeah, so let's talk a bit more about the pressure on healthcare workers. We've heard workers themselves, we've heard unions complain from March up until now that they're not getting adequate support or rest time or more personnel. Is the South African government actually failing in this regard?
I'm not sure that I would say failing. I think that the government has put in a huge effort, and so has everyone. This is a national effort, and everyone needs to work together really hard to pull together to defeat something that is completely unprecedented. That said, what we do think is that there is a bit more need for reactivity and agility in what we're doing. This isn't a traditional crisis. We've never seen anything like this before, and it's really important that we think out of the box in how we handle it. And what we think is that human resources and doctors and nurses are under a huge amount of pressure, as you said, and what can really help to ease that pressure is more people on the ground. We know that those people exist. We just want to be able to climb through that bureaucracy at extra speed during this pandemic so that people can actually be in the wards where they are needed as they are needed.
So what's the holdup?
That's a good question. I think that the health system is a complex beast. There's a huge amount of complexity in assigning human resources, and I'm not in the National Department of Health, so I honestly would not be able to tell you exactly what the holdup is, but I think there must be ways, I hope there are ways to be able to jump through whatever it is that's causing these blockages and just get people onto the ground. That's why we're raising this alarm at this point. We know it's possible, and we know that the government has put huge effort in. So we're hoping that by raising this alarm bell, we can see the action that we need to see to save lives.
Yeah, and as things stand, looking at this second wave and how the numbers are somewhat higher on some days than the first wave, what's the worst case scenario here?
Well, I suppose it would be losing control completely. I don't think that South Africa is really in danger of that. We saw in the first wave that we did manage to pull together. We had significantly less deaths than anticipated, and overall came through the first wave difficult but relatively unscathed as to what some predictions were worried about. We really don't want to now be complacent in the second wave and say, okay, well, the first wave is over, we were fine, so let's do the same. I don't think so. The second wave is really showing itself to be punishing us already, and so we need to take it really seriously and not lose control. We don't want to see skyrocketing numbers of deaths, etc. That just wouldn't be great at all, obviously.
And just before I let you go, Claire, I know that you guys have set up areas in Khayelitsha, for instance, and other parts of the country to help with the treatment of people. How is that going? What are you seeing there?
That's a great question as well. So during the first wave, we set up a field hospital in Khayelitsha where we were working with patients. We repurposed all of our projects across the country. So that's in Khayelitsha, in KwaZulu-Natal, Rustenburg, Tshwane, and even in Johannesburg, we set up an emergency project with mobile clinics with the city of Johannesburg. Most of those projects, when the first wave wound down, we were able to also wind down, but we do have our ear very close to the ground again. And as you've seen, when we're needed, we do react very quickly, which is why we were able to very quickly get to Nelson Mandela Bay and send in staff urgently as quickly as it was needed. So what we're seeing, I think, at the moment in our projects that already exist, we're seeing that numbers are rising at a worrying rate. And what we saw in Nelson Mandela Bay is that there wasn't enough HR, which is why we focused our intervention on that. We're very concerned at the numbers of severe illness coming in. It's higher than it was in the peak in some places, and it's extremely worrying, which is why we really need to be focusing on very quickly reacting, and everything else at this point is not as important. Speed and agility and reactivity are the critical factors here if we really want to be on top of this pandemic for the second time around.
Yeah, definitely. And I guess that's why the President's going to address us tonight on new regulations. Thank you so much for your time. We appreciate it. Claire Waterhouse from Doctors Without Borders.